And the last dimension of ABA is generality or generalization. And this is the most important dimension of ABA. What this means is, and I kind of alluded to it before when I was talking about effective, this means that when the child masters a skill, they can use that skill across settings. They can use it with different people and within different contexts. And they actually can, in other instances, they even learn other skills because of the skill they learned. And I'm going to give you a quick story to generalize, to talk about what I mean about that. So I was once called into a school. There was a little girl who was 4, had autism, and she was in a Montessori preschool. And the school loved her. They thought she was thriving. But the parent had learned that their child should have ABA, and they were suggesting that she be pulled out of the classroom and put in a one-on-one ABA program all day. Well, the school called me in, and I met with them, and I met with the parents, and everybody agreed that we would try to, instead of pulling her out of a really great preschool classroom with lots to learn from, we were going to bring the ABA interventions into that classroom. So I did the assessments that I'll talk about today. We developed goals and interventions, and one of the there was a list of goals, and we were going to address them little by little. And there were 2 goals. One was that the student would answer questions during group instruction, because she never did. She would be called on, but she wouldn't speak. And another goal was that she would raise her hand to participate during group instruction. Well, logically, we started first with her answering questions during group instruction, not raising her hand. And what was terrific was her teacher implemented the ABA intervention with fidelity, following the procedures, and she learned how to answer questions during group instruction. Well, once she learned how to do that, she actually started raising her hand to answer questions. So the intervention of responding to questions actually generalized, and she started raising her hand to participate. So we actually never had to develop an ABA intervention for raising her hand, because she did it as a generalization of responding to questions.